Joining me in this Tell Me More About session is Chris Lapos from Cyprus. Chris, welcome.
Thank you very much. It's a great honor to be invited.
Exactly. We're going to do a deep dive into the topic of aligner orthodontics. You're an expert in that field, and we want to know all you can tell us about that. So let's start with the basics.
Okay.
Aligner orthodontics are relatively new to the field. What do they mean for the field of dentistry?
I think they changed the way we treat our patients. They're relatively new, I agree, because personally I got certified on this topic 20-something years ago, so it's almost 25 years ago. And however, the recent advancements of digital orthodontics, the scanners, the digital technology, the programs we are using, they help to improve these applications in orthodontics. And they have made a tremendous change in the way we treat, the way we see, the way we diagnose, and mainly also change the way our patients can see orthodontics, because it's not the traditional braces anymore.
Exactly. Before we dive deeper, this is an implantology congress. What is an orthodontist doing in this implantology congress?
Yeah, that's a good question. So, implantologists and prosthodontists that they work together to place implants and do the prosthetic final work, they need our help many times, because this is what I call dental team. The orthodontist should be part of this team, because many times we have to adjust the arches, create some space or close some spaces. So the orthodontist is actually helping them to prepare their patients for the final implants and the final restorations.
Exactly. In another session in this online library, I learned that actually the aligners now also make it possible to treat adults, in contrast to traditional braces. Do you recognize that?
Well, traditional braces also treat adults.
Of course.
Yeah, orthodontics is not for young patients. We treat.
But the perception is there, right, in society?
The problem is that adults, they consider that braces is not for them aesthetically. So that was the main reason. But the big benefit of aligners is not the aesthetics. I consider it's also they're more comfortable. They have less emergency, so you don't have the brackets or the wires that could poke and you have to go back to the clinic. And they're also more hygienic. So you take them out to eat, you take them out to brush and floss. So they do help a lot the benefits for our patients.
Actually, much more than just the aesthetics. That's just an additional benefit. So you said they've been around for 20-25 years.
Yes.
What is the latest insights around aligner orthodontics that you bring to this Congress?
Well, what I presented, I presented a case that we prepared with aligners. It was kind of a difficult patient with things that we had to do to create space. And
what was the main challenge in this case?
The main challenge was how to distalize teeth. Now we're getting into terminologies, but actually we wanted to achieve good occlusion, because in orthodontics we want our patients to have very good bite besides the aesthetics. So these two things, they always go together. So you cannot have just aesthetics. It's not just aligning teeth, You want the teeth to bite together perfectly. And what I showed was that we have to stick to the basics. We do have the technology. We have digital orthodontics. We have aligners. We have scanners. So we have all those tools to help us use our basic knowledge to get to the point we want. So you have to have this basic knowledge and understanding of biology. It's not just the aligners or digital dentistry that are achieving your results.
Yeah, and the message that in the end it's also functional, right? Function should be key.
It's function and aesthetics together. So those are the two things. But also one of my take-home message of my presentation was communication, because you want to communicate with the other dentist, the other specialist, but you have to communicate with your patients. So you have to give them the end result and explain everything to them, what is the plan and also the cost of the treatment, so they can get a good understanding of what you can offer to them. And also communication among the specialists. So it's both ways.
Exactly. Now, hopefully a lot of specialists, in this case implantologists probably, or dentists with an interest in implantology are watching this. What else should they learn and know about the opportunities that the aligner orthodontics offer?
Well, first of all, cooperation is key, you know, because many times they ask...
Get the orthodontist in the dental team is the first message.
Yes. Sometimes they're kind of afraid if you don't have good communication or they're not close to you. One of the things that a prosthodontist or an implantologist could be afraid is the length of treatment. So they have to know the length, and they also want to know the cost. And those two factors, they can make them kind of stay away from the orthodontic preparation and say we can do everything with the prosthodontics and the implants. But on the majority of the times, the orthodontic work, the preparatory orthodontic work, can really help to achieve much better results. So,
yeah, so you would always say it's worth the extra investment.
It's worth, and you know, many times, if the cost, if this cooperation can raise the cost, can always discuss, you know, maybe you can lower your cost if you want to help your colleagues to do their work. So those kind of things, we do it every day. Yeah. But the best thing is to communicate, to have all the parts of the team, including also the patient, to have the same goal in mind. Otherwise, the results cannot be as good.
And what type of length of treatment are we talking about? If I send my patient to the orthodontist to create space or to align, obviously it depends on the case, I understand. But in general, what time frame are we looking at?
Yeah, we can have patients that can be treated in 6 months, 5 months, but then the difficult patients, not difficult, but the
more
patients
complex cases
that they need more work, maybe a year and a half.
Yeah.
So it always depends.
Between 6 and 18 months.
Yes.
Before we see them back.
Yes.
Yeah.
We do have some patients that the treatment may take 2 years, but those could be cases that they need surgery or more lengthy procedures to be able to finalize.
Is there actually, I'm just thinking about it now, when I envision the aligner braces, they're often transparent, it's one of their benefits, but if I'm missing a tooth or I'm missing multiple teeth, is there a way that you can aesthetically also fix that inside the aligner braces, or does that not happen?
Yeah, this is something we face quite often. So many times we can paint the aligner, you know, where you have the missing tooth with the same color of the adjacent teeth, so it doesn't show. The problem on this is when you take it out to eat, when you go out to a dinner.
Yeah.
But at these occasions, you can bond, you can build something on the adjacent teeth like a composite restoration, which is temporary. Yeah. So your patients can have the aesthetic outcome they need and go on with their treatment.
And you would solve it like that and not with the aligner.
Yes. So we have solutions. Nowadays, dentistry has tremendous solutions, and it's a matter what you want to achieve and what's the level of dentistry you want to deliver to your patients.
Exactly. Now, Chris, what else do you hope your audience in this Congress, these implantologists, walk away with? What should they do next week when they're in the clinic, besides looking around them for an orthodontist that can help them with the aligners? What else do you hope they do?
I think this is probably the most important, to find the best orthodontist close by to work with, to communicate, because sometimes we talk about communication and we think it's a fact. But living in a busy day and practice, it's not very easy. You know, everybody's working in the patient's mouth.
Yeah.
So you have to set the time to discuss.
How do you do it? Do you have like a fixed day and time for interdisciplinary meetings, or how do you approach it?
I don't have fixed days, but I try at the end of the day, if not during the day, to speak. And always when you call somebody, it's not always easy to pick up the phone right then, because they may be working with patient. But if you want to talk to them right on the spot, if you have a patient in the chair and you want some information, then you can't wait. So it's a little bit tricky. And my problem in the area that I work, I find that some, not all of them, of my colleagues may kind of stay away of this communication because it's not very easy. But at the end, for the benefit of our patients, you have to find the time, you have to discuss, you have to meet many times, you know. So I take my car and go to their offices and invite the patient so we can see them in the same chair and discuss.
Together with the patient.
Together, yes. Because it's okay to exchange videos and photos, but if you see the patient on the chair right there, you know, the 2 or 3 specialists together, it's easier to make a more wise decision for the benefit of our patient. And I think the patients also appreciate that.
Yeah, I would feel very well taken care of if 2 or 3 specialists come sit around me and discuss. Also a bit scared because I thought, are they not sure what the right approach is?
Scaring, you know, to feel scary in a dentist nowadays, I think doesn't exist because the way we work, you know, it's very easy. I think all the procedures, you know, are being done in a nice way, and we have very good dentists around that they deliver excellent results.
Exactly, exactly. Well, thank you, Chris, for taking time out of your busy schedule to also communicate in this Congress with us and tell us more about the opportunities that the aligner orthodontics offer.
Thank you very much for inviting me. It's a great honor. You had a great meeting, and it's a pleasure to be here. Thank you.
Thank you, Chris.